Good morning. I'm calling to order this meeting, the House Early Childhood Finance and Policy Committee. I'm Representative Dave Pinto, the chair of the committee. Welcome to members and to members of the public as well. This hearing is being held pursuant to House Rule 10.01, which allows for virtual hearings of this type. And I want to direct the attention of members of the public to our committee website, where you'll find the agenda for this hearing and meeting materials, etc. And so please check that out. With that, I'm going to ask the clerk to please call the roll.
Representative Pinto, Chair.
Present.
Representative Pryor, Vice Chair.
Present.
Lead Franzen.
Present.
Representative Bennett.
Present.
Representative Bolden.
Present.
Representative Daniels.
Present.
Representative Davney.
Present.
Representative Damath.
Present.
Representative Jurgens. Representative Jurgens. Representative Cotiza-Wattoon.
Present.
Representative Morrison.
Morrison present.
Representative Wasilwick.
Present.
Representative Volgamont.
Present.
We have a quorum.
Members, again, very glad to have you all here today. So we have a number of things going on. We're going to launch right into an update from Dr. Cynthia Osborne from the Prenatal 3 Policy Impact Center. And I guess we'll do the minutes at the end of the meeting. She's joining us. Members will recall that we received a presentation last year from her. And so this will be an update on the 2022 version of Minnesota's roadmap. And I just want to note that Dr. Osborne has been doing, and her Policy Impact Center have been doing a tremendous work all over the country. And I found her and the center to be a great resource. I'm so grateful to have her here. We were talking just before the center's moved from the University of Texas at Austin to Vanderbilt University. It sounds like that's going well. And we're so glad to have her back. And so Dr. Osborne, if you can please proceed with your presentation, and then we'll move to some questions. And members, we're going to be taking under about 45 minutes, maybe even a little bit less. We'll see how it goes in order to get to the other things on our agenda, just for your planning purposes. Dr. Osborne, please.
Great. Well, thank you, Representative Pinto. I really appreciate the opportunity to share this information with this committee that is doing so much to try to support children. And just to clarify, the roadmap was actually released in October 2021. And we are in the process of monitoring all that states are doing now, and we'll release kind of the summary of that in October 2022. But I will share with you, because the roadmap this year is completely updated and has even more information. So I will share my screen. Let me just make sure I can do that here. Let's see. All right. So again, I am so excited to have the opportunity to talk with you. Our whole purpose of existing for the Prenatal 3 Policy Impact Center is to be a resource for states as you try to determine what's the most effective policies that you can implement to try to ensure that children get off to a healthy start and thrive. And I won't spend time on this because you know very well how important the earliest years are, but all of our work builds on the science of the developing child that is very clear that the prenatal to age 3 period is the most rapid and sensitive period of development. That if we can get it right in those first 3 years, we really set children on a lifetime trajectory of health and well-being. But if we don't get it right, if that chronic adversity in those earliest years can have long-lasting neurological, biological, and social consequences. And our efforts are really to identify those children who need the opportunities from the start and to close persistent gaps or disparities that currently exist. And so what we did was turn to the evidence to identify what are the state policy choices that states can make that will empower parents and support children's healthy development. And we know that it will require not only programs that target children directly, but that we also have to care for their caregivers, because in those earliest years, those nurturing relationships are what build healthy brains and bodies. And so making sure that the parents have the skills and resources that they need to be the providers that they want to be and strive to be, and that when children are not with their parents, that they're also in these nurturing relationships. And the research is also clear that there is no magic bullet. There is no one program or policy that we can implement and expect that everything is going to be okay. That it does require a combination of broad-based economic and family supports and more targeted interventions to really make sure that our children get off to this healthy start. You may recall that from the Science of the Developing Child, we identified these 8 policy goals. And I've reviewed them already. For the sake of time, I won't go into detail, but these are the conditions that children need to thrive. And our whole purpose was to identify, well, what are the policies that help to create those conditions? But first, we wanted to review how each state is doing toward meeting those goals, so that states can have an idea of where they may want to prioritize. It's hard to address every goal at one time, and building this system does take time. And we're not here to tell any state what they should do. We're here to tell you where you stand and what the evidence says of how you can get to wherever it is that you want to go. And Minnesota is so strong in so many of these outcomes. We identified a handful of important outcomes related to each of those policy goals. And although Minnesota strives in lots of ways, one of the things that we are trying to pay attention to is whether all children in the state are experiencing similar sorts of outcomes, and where there might be some gaps of areas for potential improvement for children. So, one area, for instance, in Minnesota, is that among those children who are eligible to receive SNAP or food stamps, we have a high proportion of children who in fact are not receiving that. But you can see that there's a lot of areas in which Minnesota is incredibly strong. So what are these policies and strategies that we've identified that help to create those conditions and lead to better outcomes for children and their parents? And so we created the Prenatal to 3 State Policy Roadmap. And this year it is fully online. We took feedback from state leaders about how it could be more useful. And so there is a US version, and then there is also a state version that has information kind of in summary for all, how a state is doing on all 11 of the effective policies and strategies that the research says are the things that work most effectively. And it goes into lots of detail on any particular one. And I'm going to share with you at a high level what some of this information is and how Minnesota is doing. And we don't only track kind of outcomes and policy, whether you kind of implement it or not. We are very interested in policy progress, understanding that it's a long game. And so we look over time at the changes that states have made in both their policy adoption, their generosity, their reach, so that states can learn where they have room for improvement and how they compare to other states. This framework is what we use to demonstrate how these policy goals are aligned with each of the effective policies and strategies. Again, to identify these effective policies and strategies, what we did was turned and reviewed thousands and thousands of papers and hundreds of causal studies, high quality studies, to determine what the research says actually, what the impact these policies have. And no policy will impact every outcome, but you can see whether you start with what your policy goal is, or you start with the policy itself, what the alignment is with these colored dots about which policies impact which goals. And so again, the policies are a combination of these broad-based and economic and family support, such as Medicaid expansion, which you were one of the first states to do, making sure that families have low administrative burden in order to access what they're eligible for. We use the example of SNAP because it's the most effective and largest nutrition program that we have. A paid family leave policy, which has an impact on several of the policy goals. A state minimum wage that's at least $10 an hour, and a state earned income tax credit that's at least 10% of the federal and refundable. And then we also identified these 6 strategies. And the only difference between a strategy and a policy is that they all work. The research, it says each of these things is effective at improving outcomes for infants and toddlers and their parents. However, the research is clearer for policies as to exactly what states need to do in order to get that impact. Whereas for strategies, it's not exactly clear how much you should fund, what the optimal rate is. And so we're doing more and more research to understand what that guidance is for states. But these include programs such as Family Connects and Healthy Steps that you have in Minnesota that identify and screen families for any of the needs that they have, connecting them to the programs that they need, not just what we have, what it is that families need. Our child care subsidies that allow families to access affordable, high quality care. Group prenatal services that provide more social inclusion and support during the prenatal period to lead to healthier birth outcomes. Our evidence-based home visiting programs that focus on parenting. Our early Head Start and our early intervention or Part C services. These are all effective, and this combination of them is what it is that leads to these stronger systems of care. So currently, of those 5 policies that you either get a yes or a no on, Minnesota has 3 out of the 5. So currently, it does not meet the criteria for reduced administrative burden for SNAP, and it doesn't have a paid family leave program, but it does meet the standard in all of the others. Unlike my 2 states right now, Texas and Tennessee, who are among the 7 that haven't adopted any of those policies yet. And like we said, we're tracking policy changes over time to see which states move from not having a policy to actually adopting it. And there were 5 states that added an additional roadmap policy this past year. And in fact, Missouri implemented 2 of the roadmap policies and moved to not having it to having that check mark. But that really masks all the activity that's going on. And so for each of these 11, we've been tracking what it is that you're doing in all the other 50 states to really understand what the whether there's any policy kind of progress, not just whether it was fully adopted. So for instance, we know that paid family leave was something that was seriously considered this past legislative session. And we have also been following what you're doing in each of these strategies as well. So that's just a summary, and I'm going to go into a little bit more detail. I want to be very mindful of time, so I'm not going to go into great detail. I'm here to answer any questions that you have. But for each of these policies and strategies, we provide the following sort of information. So we begin by demonstrating who it is across the country that has fully adopted and implemented the policy or strategy, or especially with the policies, what goals it is that they impact. And for folks who are driven by evidence, we try to provide a summary or a snapshot of what the most rigorous research says the impact of the policy is for each of the policy goals. So for Medicaid expansion, for instance, obviously this is something that you've adopted for been implementing for quite a while. States now are considering whether to extend postpartum coverage for a year, which will allow for more continuous coverage following the birth of a child and hopefully lead to fewer incidences of maternal mortality or severe morbidity. But for each of these, go into the kind of impact that it would have, and then demonstrate kind of both the generosity and the reach or the impact of the policy on families' lives. So for states that have adopted the Medicaid expansion under ACA, they have a minimum of income threshold for eligibility of 138% of the federal poverty level for parents. You can see in gray the states that have not adopted the expansion or expanded Medicaid, that level is considerably lower. In Texas, for instance, you have to have income below 17% of the federal poverty level for a parent to be eligible for Medicaid. And that's strongly correlated with the percentage of low-income women of childbearing age who do not have health insurance. And so Minnesota is among the top half of states in ensuring that women are covered, but still a little over 13% of women who should be eligible for Medicaid do not have any health insurance. That's considerably less than the nearly 48% in Texas, where I currently am. For SNAP, so administrative burdens, these are policies that just make it more difficult to actually access things that you are eligible for. This is not about expanding eligibility. And SNAP, as I said, is one of the most effective policies that are out there in reducing food insecurity. Up to over a third fewer households are food insecure when they are able to receive SNAP. And we know how to get more families on SNAP. We need to make sure that the recertification period is longer, and we need to make sure that there's simplified reporting as well as the ability to do all things online. And with the pandemic, we've seen that more states were able to do this even temporarily, and it didn't lead to higher instances of fraud or abuse. But when we make it more difficult to access this program, then we have high percentages of families who are eligible who are not receiving that. So you can see that there's 13% of families who could receive SNAP who are not. A paid family leave program is one of the most effective policies at improving outcomes for infants, and it has better outcomes for the parents as well. And so from allowing parents to be able to work, to increasing household resources, to improving coping and reducing reliance on alcohol consumption, for stress-related relief, to increasing the attachment and time that parents get to spend with their children, to breastfeeding and vaccination rates and reduced head trauma. A paid family leave is a program that has myriad benefits for families. But there are currently 10 states that have adopted a paid family leave program, and only 6 states so far are families actually receiving the benefit. But what we do in the roadmap is we go into great detail about how each of the state is paying for it, what the benefit level is, who's eligible, and so forth, because they vary so much. There are some states in which it's all employer paid. There's some in which it's all employee paid, and there's others that have a combination of the two. And we're trying to do more and more research to find out what is the most effective way to serve families. All right, I'm going to just kind of go through for each of these policies and strategies. You can have any of this sort of information, but I want to make sure to be able to spend a little bit of time on childcare subsidies, because I know that that's something that is a huge issue and something that you have really been addressing. And I'd like to illustrate the impact that the recent changes have had on families' resources. So again, for each of the strategies, pardon me for just scrolling through pretty quickly here, the thing to pay attention to is whether, not just whether you offer the services, but what proportion of families are actually receiving it. So for instance, you do offer centering pregnancy or group prenatal care, but a very small fraction of families actually receive this. By contrast, with your home visiting programs, there's a large percentage of families relative to other states that are receiving those programs. Early Head Start, you're in the top half of states. You are one of few states that actually put state dollars into early Head Start. And for early intervention services, although maybe in the more middle or bottom half of states in terms of the percentage of kids who get it, within your state, you're one of the top states that actually ensure that the gaps between children of color and white children receiving it are very small, which is something to be commended. All right, with child care subsidies, we know that these are important. Right now, they are more important than ever in terms of allowing families to be able to access work. And this chart, I don't expect you to take anything away from it, except for the idea that you can see from the length of these bars that the amount of childcare subsidies varies considerably, and the cost of childcare varies considerably across all 51 states. And these are just listed alphabetically, so you can get a sense, though, in the roadmap of where you are relative to other states. The information that's provided here is the information from the roadmap, which was what was in place as of October, or actually August 1st. And so I will show you how the updates have changed things. But the length of the bar, the whole length of the bar, is what's considered the 75th percentile, or the equal access target. And you guys have now increased from, I think it was the 25th to the 40th percentile. I'm sorry if I'm off on that, but this demonstrates kind of where your reimbursement is. This is for a family making 150% of the federal poverty level, where your reimbursement level is relative to that 75th percentile, and what proportion it is that the state provides or pays to the providers, and what the family's co-payment level is. And you can see how you compare to some of the states that are nearby. And so we look at several different things for states to be able to pay attention to. What is the percentage of co-payment? It's recommended that it's not higher than 7% of a family's income, and you certainly are below that mark, which is good. When we look at what is the family's share of the total cost that's being paid in Minnesota, it's about 28% for a family who makes 150% of the federal poverty level. And the 75th percentile is based on the market rate survey. And there's a lot of research that suggests that that market rate may underestimate the true cost of care to be able to provide salaries to workers and to have the ratios and the type of curriculum and supports that you need. And so it's estimated that the real cost of care, that what you're doing now is about 80% of the kind of base quality care true costs. Another area that states can pay attention to is whether they can expand eligibility, so offer childcare to more folks. The federal rule is that you can only offer it up to people who earn less than 85% of the state's median income. And right now, your level for eligibility is right at 47% of the state's median income. All right. So you made these rules. I don't have to tell you about them, but they went into effect. The rules that went into effect in November, we have documented, and again, you've moved from the 25th percentile to the 40th percentile, and you've increased the base reimbursement rates, and the highest quality reimbursement rates have also increased substantially. And I wanted to just end with showing you how all of these states' policies combine to provide resources for families. So at the end of the day, what do families have in order to care for their children? And this is just a simulation so we can compare across states. So in the simulation, we're looking at a single mother family who has an infant and a toddler, so 2 children, and she works full-time all year at the state's minimum wage. And she leaves her children in childcare in order to work full-time. And she leaves her children in a childcare center that charges that equal access target of the 75th percentile. So center-based at the 75th percentile. And So I'm just going to illustrate what the difference is between families' resources in Illinois and Wisconsin as compared to Minnesota. So if we just begin with earnings and you work, full time, then a family in Illinois is making slightly more because they have $11 an hour. In Wisconsin, they have the state's minimum, or the federal minimum wage of $7.25. So you can see where Minnesota is right in the middle. But remember, she has to pay for childcare in order to work. And so what are those out-of-pocket childcare expenses that she has to cover in order to have a spot at that 75th percentile cost? And you can see that in Minnesota, the copay is very small. There's a dark red line there that you can barely see on the Minnesota graph. But if she wants to go and to leave her children at a higher quality place, then her out-of-pocket costs are going to be quite substantial. And so that advantage that you had over families in Wisconsin has now been lost due to out-of-pocket childcare expenses. And by the way, these are using your newer rates. So just the most current rate to date. If we added in all of the state taxes or benefits that are available, tax credits, and the nutrition benefits, so both the blue is SNAP and WIC, and the green is the federal and the state child tax credits or earning tax credits, that you can see that there's quite the level of resources is increased quite substantially, and we've almost caught up to Illinois and have passed Wisconsin because of the generous state earned income tax credit that you have. Families this past year also got these benefits from the American Rescue Plan Act, or ARPA, and that made a huge difference for families in Minnesota. But it was only temporary, and it no longer exists. And the reason that it mattered so much is that that dark purple, that's the child care and dependent tax credit. That's going to offset those parents' out-of-pocket child care costs for the year. But that doesn't exist any longer. So if you just look at everything before the purple, you can see where Minnesota families who work a minimum wage job compared to Illinois and Wisconsin. This is just to illustrate the difference that you've made in reducing those out-of-pocket childcare expenses by expanding the reimbursement rates. So the top bar is what things look like as of August 1st, which was what was in the roadmap. And the bottom bar is what it looked like after the changes that went into effect in November. Again, the ARPA, the purple benefits are no longer going to be here. So it would end where the yellow bar is. But you can see that you've substantially reduced out-of-pocket childcare expenses for those who want to access higher quality care. For a lot of families, if they have to pay that large of out-of-pocket, they're going to seek lower cost and often lower quality care. This is my final graph, just to illustrate to you the variation across the country in families' resources based on their state's policy choices. So it ranges from a high of over $42,000 a year for families who work a minimum wage job in the District of Columbia to fewer than $22,000 for families that work a minimum wage job in North Carolina. And Minnesota is obviously right here in the middle. So I'm going to stop sharing my screen because I'm really here to answer your questions, not to just give you any sort of lecture. And I'm hoping that in the chat that my team put the link to the roadmap, and so that you can access that and look at it in any way, the level of depth that you would like to. But I'm definitely here to answer questions if we still have time.
Thank you so much. Yeah, no, we certainly have a few minutes for that. And I know for members of the public as well, the website for the Prenatal 3 Policy Impact Center has the roadmap. It's extremely easy to find, and there is a vast array of materials. I know that our time this morning is a little more truncated than I had hoped, but many of the slides that Dr. Osborne had to move through, I think sort of all that material is on there in a very well organized fashion. So I really encourage everyone to go in that direction. I found Dr. Osborne to be a great source of knowledge about all kinds of aspects. As you can see, there's a lot of different issues that come in here. So members, please raise hands if you have questions or comments. and we'll bring you on in. And I've got, I think Representative Morrison was the first one. So Representative Morrison, please.
Thank you, Mr. Chair, and thank you so much for that presentation. I avoided the urge to ask you to stop at various points so I could study those slides. There's so much stuff in them. Thanks for your work. I wanted to ask a question specifically about the last one about total available resources for a family of 3. And you touched on the reasons, obviously, but I'm wondering if you could elaborate just a little bit more, because it strikes me that we're in the bottom half, and that's going to make Minnesota less competitive. And I'm just wondering if you could speak to why we seem to fall in the lower half on that slide of available resources to families.
Dr. Osborne.
So I think that there are 2 major drivers to the total resources. And remember, this is a simulation, and it assumes that a family is working at a minimum wage job. We know that in the current market that folks' wages are slightly higher. And it also assumes that the family is leaving their children at a child care center at the 75th percentile of the market rate, that equal access target. And it's that piece, that out-of-pocket childcare, the difference. So you're up to 40th percentile for your kind of most base reimbursement rate. And that means that families are going to have to pay substantially out of pocket in order to access that higher priced childcare, if you will, that's often linked to higher quality. There are several states that DC is one of them, for instance. It does have a higher base reimbursement rate, but it also does not allow providers to charge that difference. So if a provider is going to take a subsidy, it has to use that subsidy value, and it can't charge families a higher fee. That's hard on providers to do, and so they may be less likely to take subsidies. But that is, it's the out-of-pocket childcare expenses that are really pulling you down in that simulation.
Representative Morrison.
Thank you for that explanation. So just to emphasize your point that it's the high cost of childcare in Minnesota that is the main driver of that.
That's right.
Dr. Osborne.
Sorry. Thank you. Yes, that's right. That would be accurate.
Thank you.
Thanks, Representative Morrison. Representative Waslewick.
Thank you, Mr. Chair. And it occurs to me as I'm thinking about this question that I may have asked this question last time we had a presentation on this topic, but I just was sort of wondering, I know the different pieces you had sort of highlighted, like the positive impacts of like paid leave and higher minimum wages and that sort of thing. Do you have a sense for how those pieces are weighted? So I don't know if you've seen in states that have done like for, like a majority of those things, they have these outcomes, that have done very few of these. If they have these outcomes, do you have a sense for like how those pieces are weighted in terms of which ones have a larger impact on kids and families and which ones have a smaller impact?
That's a great question, and something that we're actually exploring more empirically so that we can try and answer that. Although it's hard sometimes to put them up side by side with each other, because as you can see in that kind of grid with the colored circles, different policies impact different policy goals. And so we were thinking that states can lead with what their goals are and then identify what the most effective policies are that help to get there. In our, we're going through some analyses now, especially focused on policy, the impact that policies have on reducing disparities in outcomes. So for instance, we're looking at our goal of healthy and equitable births. Well, there are several different policies that improve birth outcomes: Medicaid expansion, a state minimum wage of at least $10 an hour, and an earned income tax credit that's at least 10% refundable. Those 3 work. Well, when you dig a little deeper to say, well, which are the most effective? What has the biggest impact? I wish the studies, all lined up perfectly. They don't, but there are some ways of demonstrating that the combination of those policies, especially a minimum wage EITC, that has a much larger impact. when it comes to actually reducing disparities in outcomes, well, an earned income tax credit seems to have the largest reduction in disparities in birth outcomes. But things like paid family leave, that reduces, leads to improvement for women of color following the birth. So for that kind of postnatal time period. So I'm sorry, I'm sounding like a professor that I shouldn't. I put my professor hat on for a second, so I apologize. But it is hard to make these apples to apples comparisons because all of the policy studies are so different. But there are some that kind of have the larger impacts. The economic resources are the ones that lead to kind of the largest impacts on families. But again, I would say it's really important to begin with what the goal is and look within that.
Okay. Representative Wozniak, looks like you're all done, I guess.
Yep, I'm good. Thank you.
Okay. Okay, good. Thank you. Representative Bolden.
Thank you, Mr. Chair, and thank you, Dr. Osborne. This presentation was excellent, and really appreciate all the data that is included. It's a lot, and so certainly we'll go back and parse through that a little bit more. And you actually read my mind a little bit, and so maybe you have answered all of this, but my mind was actually going to what you just spoke about, is the racial disparity piece. So as we know, we have significant racial disparities here in Minnesota. I wonder if there's anything you would add just in terms of your research about, where Minnesota falls with that and the impact of those policies in terms of closing those gaps.
Yeah.
Dr. Osborne.
So that is definitely a goal of our center. Like I said early on, is that we want to identify the policies that work, and we want to make sure that we're helping those who really need the help the most, and that these policies are closing gaps. Unfortunately, the data at the state level that shows us all those outcomes doesn't allow us to really see them all by race, ethnicity breakdowns in a lot of states. So in a state like Texas that has 450,000 births a year and 60% of those are children of color, we can get a much better understanding of those breakdowns by race, ethnicity. In some other states, and Minnesota is among them, in which the numbers start to get pretty small when you break it down in international samples, the data don't allow us to look as deeply as we think that we should. And so we strongly encourage that states are tracking these data by race, ethnicity, so that because you have the whole population, everything. The national data doesn't have that. But the policies, there is a lot of evidence of those that actually try to reduce these disparities. And Medicaid expansion has a huge role in reducing disparities. And the research hasn't been done yet on expanding the 12-month postpartum. But there's a lot of hope that it is going to reduce one of the biggest disparities that exists in every state, which is the huge disproportionate number of Black women who die in and around childbirth relative to their white and Latina counterparts. And so that Medicaid expansion, we think, is going to be a big role in that. But the minimum wage and the earned income tax credit are two policies that do lead to a reduction in disparities in several of the outcomes. Early Head Start is also a policy that has been shown to have greater impacts for Black children than for other children. And so that is another policy that needs to be studied further of how and why it's working that way. But it does seem to play a really important role in the cognitive and social emotional development of children of color.
Thank you, Dr. Osborne. Looks like Representative Bolden all done there. And so we'll give Representative Pryor the final question, and I'll just ask her, we want to wrap things up real quick here. And to Dr. Osborne. Representative Pryor.
Thank you, Mr. Chair. And maybe this is a question that's not answered now, but something that we can hear more about perhaps in the future if there's any information. But have you looked now at that, the study that was done where cash payments were made to low-income women, families, and St. Paul being one of the locations of the study, and what kind of, as I've read it, that research was really encouraging, that it did have a huge impact on children's lives, and wondering if you have the official word on that.
Dr. Osborne, maybe you can point us in the right direction real briefly.
Sure. That study, the title of the study is called Baby's First Years. And the Institute for Research on Poverty in Wisconsin just held an event yesterday that did a fabulous job going through all the details of that study and how it was conducted and its impact. And so I encourage you to look that up, and the video would be available. That study randomly assigned families either kind of a larger cash payment around $333 a month, or a smaller cash payment about $20 a month right after the birth of their child. And what they are showing in the first year, now it's just the first year, is that children who were in families that got the larger cash payments had more kind of higher or faster brain activity, which is something that other studies, not causal, but other studies have linked to kind of higher cognitive development later on. So it is early on. We know that families were spending that money on their children. We know that that this was, an important 17% of most of the family's income. But it also, we know from the expanded child tax credit that took place as a result of the American Rescue Plan Act, that reduced child poverty to levels that we haven't seen in, ever. And so we are going to be adding a child allowance to the roadmap, not this year. We're going to roll out kind of what it is and how states are currently doing it, and then start to kind of give states credit for it in a subsequent year. But we do believe that a cash allowance is a really effective policy at reducing the financial stressors in families, and can potentially have important impacts on children's healthy development.
Dr. Osborne, thank you for that. Thanks for the question, Representative Pryor, and members of the public. So this has really been a refresher for those who were aware of the roadmap previously, an update. But if you're new to it, really again would encourage you to go to that, go to the website for the Policy Impact Center, and dig in. As Representative Morrison said, there is a lot there, and Representative Bolden as well. So Dr. Osborne, thank you so much for being with us and for your work. And just a personal thank you, because we've had a number of chances to work together, and I really appreciate your expertise. So thank you so much.
Thank you, I appreciate it. And the slides, I believe, are available for if anyone would like to see them as well.
I think
Okay.
folks will definitely need to, a lot of material there. So yeah, that they are posted on our website. I encourage everyone to check them out. So thank you so
Great.
much, Dr. Osborne. Good.
Thank you.
Thank you. So members of the public, so I'm realizing sort of an error in the agenda, and this is entirely my fault, that we're actually going to be receiving a presentation from the Department of Human Services, an update on the work that we all did together in 2019 relating to program integrity for CCAP. So members who are on the committee at that point, at least, will remember that we put a lot of changes into effect, really many that we pushed through. And then the beginning of the 2020 session, we received an update from DHS as to how that was going. And I think it was well received by folks in this committee, kind of unanimously, it seemed like anyway. And then in 2021, we received an update on that work. And then so now in each case towards the beginning of the session, we received those updates. And so now it's time to receive that update again in 2022. So we have the Inspector General of DHS, Kalani Moti, here, and others as well. And so I don't know if Inspector General, you're going to be the one leading off. And let me just confirm for members, and the plan is to receive this, and then we'll move to the bill that we had up on the agenda. And again, my apologies for the confusion there. So Inspector General, I think we've got you up, I think. So please introduce yourself and proceed.
Thank you, Mr. Chair. For the record, my name is Kulani Moti, and I serve as the Inspector General here at the Department of Human Services. And I believe our Legislative Director, Chris Semple, is going to be sharing the slides that we have prepared for you today. So I do realize that we're a little short on time, and I will try to make this as brief as possible, but happy to answer any questions. So can we please go to the next slide? So our CCAP investigations unit is here to primarily look at program integrity within the child care assistance programs. And our goal is to ensure that the approximately 4,500 child care providers who receive CCAP payments meet the compliance requirements. And we're really looking at doing this by identifying errors related to payment issues or related to payments issued by CCAP and investigating alleged or suspected financial misconduct by providers. We have taken the approach of really utilizing standardized processes and to be data-driven in our decision-making. And some of the things that we are able to do in response to any violations are taking administrative actions or sanctions, and then also referring suspected criminal misconduct to the Minnesota Bureau of Criminal Apprehension, or the BCA, for further investigation for potential criminal prosecution. Next slide, please. We have a multidisciplinary investigative team that has a wide-ranging experience in education and training that leads our work on this. And they are constantly in ongoing collaboration with our OIG licensing division, as well as our policy areas within the Children and Family Services Administration. Next slide. One of the things that we have implemented as a result of the 2019 bipartisan legislation is our early and often implementation. And our overarching philosophy on this is that early contact with new providers will result in fewer errors in the future. And so this contact is provided by both our licensing and CCAP investigations teams to support new child care providers in their first year by providing education and technical assistance on provider compliance, having more frequent licensing visits, and then a joint licensing and early often investigator visit within the third quarter, which includes an attendance record review. Next slide. This team also does enhanced provider communication and engagement. Part of this is providing and reviewing all of the written information given to providers during site visits related to records that are being requested and being reviewed. Providing the provider a written receipt of all records that are being collected that is signed by both the provider and DHS, and notifying and recognizing when providers don't have any compliance violations and then that they're doing what they need to do for their documentation. Next slide, please. And we're continuing to build on the success of our CCAP Investigations Continuous Improvement Project. And what we've looked at is how do we continue to ensure that the quality assurance and all of our investigations are consistent, timely, and our decisions are data-driven. And what we've done is we've established a new unit within the division that really focuses on this. And it'll ensure these investigations, not only in our CCAP investigations team, but across the entire division, are again consistent and timely. And we're developing and will oversee routine review of metrics and measures. And then I also identify any actions that we may need to do for our teams and trainings that may need to be provided. Next slide, please. And so some of the things that we have been doing over the last year or so is in response to the child care grant compliance that we've been forming in creating and staffing a new unit that is investigating and auditing our provider compliance related to the multiple COVID-19 related child care grants, including the peacetime emergency child care grants, the COVID-19 public health funds for child care, and more recently the child care stabilization grants. Now, each one of these grants does have very specific eligibility requirements that we do look at when we're reviewing and auditing the payments that went out for this. And we are looking at being proactive for compliance and reactive to investigations in response to any tips, referrals, or other identified compliance concerns that we may have. Next slide, please. One of the other things that we have done is we've enhanced our surveillance capability. So we have procured an integrated video management and content analysis tool. This has really been able to enhance our investigative activities and the things that we're able to do. It's a forensic product that preserves evidence, and we use this within investigations involving alleged or suspected financial misconduct by providers. it has proven to be an efficient and effective tool that we have. So, and this is something that was being provided out of that 2019 legislation, bipartisan legislation that you had all worked on. Next slide, please. And then some of the work that we have done in 2021 are activities. So you can see here the number of these are payment suspensions that we've done, the early and often visits that we have restarted in 2021, the active investigations that we have, how many of are open, how many of are closed, and we've identified over 600,000 in overpayments, and we have taken some administrative actions. And so these are showing the activities that we had done in 2021 and are continuing to work on well into 2022. Next slide. I believe that's the end of my presentation. So I'm open to Sandra for any questions.
Thank you. We'll bring your presentation down. And I thank you, Inspector General, and to Mr. Semple too for putting things together. I want to note, just before we move to any questions, members, that I've asked the staff to put up on our website both we received information as part of the presentation in 2020 describing the changes from 2019 and what have been done to implement them. So that's what presentation we received in early 2020, and then also that same information from last year, so we can kind of see the work that's been done. And so just asked to have that be posted up as well on our website. So Representative Franson, you've got a question, so please proceed.
Thank you, Mr. Chair and members. So my question is related to, going to pivot to the child care or the fraud, alleged fraud, right? In the food nutrition program, the USDA program administered through MDE. Now, I'm assuming that there are some child care centers, maybe some providers that are tied up in that scandal. And so have all of the child care centers, anything that DHS would have control over, have those places been looked at to make sure that they are not just shell companies and those that are thieving from the USDA program aren't thieving from the child care assistance program as well?
Inspector General.
Thank you, Mr. Chair. I'm actually going to kick this question over to Ms. Preston, who's our Deputy Inspector General for FFAID, who has been closely following and monitoring this. So Ms. Preston.
And Ms. Preston, if you can introduce yourself, just identify yourself, and then please proceed in answering Representative Franson's question.
Thank you, Mr. Chair and members of the committee. My name is Christine Preston. I'm the Deputy Inspector General of the Financial Fraud and Abuse Investigations Division. We are aware of, obviously, we are aware of the fraud issue involving the food program. We have followed carefully who the child care centers are that have been named, the businesses that have been named, and we have analyzed whether or not we have any investigations or complaints related to those. So the food program investigation is outside of the scope of CCAP investigations. It's federal funding coming out of the Department of Agriculture. However, we're mindful of the behavior and conduct of the alleged behavior and conduct of these providers. And I would just say we have them on our radar, we're aware, and we are taking that into consideration as we conduct our investigations. But it is outside the scope.
Let you finish.
Yeah, sorry,
Okay.
it is outside the scope. Yeah.
Okay, I'm Representative Franson.
Yeah, I know that this has been a topic that I've brought up in previous hearings when we've talked about the fraud in the child care assistance program. If they are frauding the child care assistance program, the USDA program is being frauded as well. And so I'd be very curious as to keep, if it can't be public record, but at least let Chair Pinto and I know, you know, the status of those investigations without compromising the investigation, I guess. But if there are things that need to be fixed via statute, I would rather us be ahead of the game rather than behind the game, and the taxpayers are still a little upset. Well, not a little upset, they're still upset over the $100 million that we discussed a couple years ago. And now the unfortunate actions of a few people have blighted the food program, which as a childcare provider, I participated in the food program too. It's a great program, and it's going to be a lot harder on the federal level for Congress to take a good look at tier 1 and tier 2 providers. You know, tier 2 providers are paid drastically less than the tier 1 providers in the food program. So, you know, discussions of increasing the tier 2 becomes a little bit more difficult if we can't get a hold of the fraud. And I'm sure it's not just happening in Minnesota. This is probably taking place all over the nation in that program. So that's what I would like to know. And then my next question, if I may have one more question, Mr. Chair.
Of course, please.
And then I don't know who from the department can answer this, but the stabilization grants, providers know that my biggest concern, and it was my big concern for the last 2 years, is that the providers are going to become used to those stabilization grants, and they're not going to last forever. So is the department aware of this, and how can we make sure that when these funds aren't there anymore, that these providers are able to sustain themselves without the payments?
I wonder, Representative Franson, maybe that may be a question that maybe need to be directed more to the Children and Family Services team as opposed to this regulatory team. That they may. Well, I see
Okay.
Ms. Sommerfeld on, so perhaps we'll just direct it to her if that's okay with you, Representative Franson.
Sure.
Okay, but Ms. Sommerfeld, any comment on that?
Sure. Thank you, Mr. Chair, members of the committee. I'm Jennifer Sommerfeld with the Department of Human Services. I didn't come completely prepared to talk through all of the grants today. We do have a proposal, as you may be aware, in the governor's budget to help stretch out some of those hardship grants so that those providers who are in extreme financial hardship are able to access aid for a longer period of time. As you know, we have a couple of different types of programs through those grants. One is base grants for all providers, that 70% of it goes to wages. And then there are hardship grants that we're rolling out, which really only is for those providers that are struggling right now. But I do understand what we are aware of the cliff effect, which I guess is what you're talking about as things change. The base grants do ramp down over the course of the 2 years that those federal funds are available. So hopefully that will provide those providers who are not needing the extreme hardship grants with the opportunity to, I guess, wean themselves off of that aid as we move forward out of the pandemic.
And I suppose, as I think about it, I mean, we're the ones in the legislature who set those grants up and decided the runway. So I guess to a certain extent, it's going to be our issue to figure that out too. But Representative Franson, anything further on that?
No, we're good. Thank you.
Okay, thank you. And I might just quickly follow up on your question, Representative Franson, just to ask, I guess, just to encourage DHS to your point, please be in touch with us as you're looking at the food program. I recognize it is separate from CCAP, but of course, the childcare portion of things, this committee has jurisdiction over. So as you identify, if you identify steps that can be taken, that are similar to the sort of strong steps we took with respect to CCAP, we obviously would love to hear those proposals. We did a lot on the CCAP side. We want to make sure that that's those protections in place on the food security side as well. Representative Pryor, I want to move on pretty quickly, but do you have something quickly before we move to the bill? Oh,
okay, I'll try to be quick. And you know, this, and I'm glad that we're pausing here and talking about, again, program integrity, which is an issue that we never leave behind. So, you know, earlier in the session, we heard about that, you know, actually getting contracts out. You know, we have this money that came in, getting actually the contracts out. It was hard to do because there wasn't staff. So now just like when we set up, or when DHS set up the program integrity measures, we weren't in the middle of the pandemic. We didn't have these additional grants and things like that. How is the workflow basically that you had not originally anticipated, none of us anticipated, how has it impacted what you're doing? And, are we still set up to preserve the integrity? Because it's, as Representative Franson said, we want to look ahead and anticipate problems and not have to find out about them afterwards.
Inspector General, if you're the right person for that, or Ms. Preston, not sure. Inspector General, please.
Thank you, Mr. Chair and Vice Chair Pryor. Yes, part of what we had done was when we were looking at the proposals around the stabilization grants and some of the new activities that were coming in, is we were also applying and looking at it from a program integrity lens and understanding that we would need additional staff. So additional staff, temporary staff for the life of the grants or whatnot had been provided in that legislation. So we have 2 temporary FTEs for grant investigation, as well as support needed in our data and analytics office as well. So we feel that we are staffed appropriately at this time to be able to handle and address and look at this. And so very, very appreciative of what the legislator did include in those proposals for program integrity and our data analytics.
Thank you, Inspector General. So members, I don't see other hands. I'd like to move on to the bill that we have up then. And so I'm going to hand the chair position to Representative Pryor. And we do want to get a vote in this morning yet. And so Representative Pryor, handing things to you, and then I will have a motion as you take over.
All right. Well, if I'm in the right place in the agenda, which I believe I am, we have House File 2927. Chair Pinto is the author. Chair Pinto, would you like to present your bill?
Yeah, so I'm moving, Madam Chair, members, House File 2927 be referred to the General Register, and if it's okay, then I'll be ready to move on to explain the bill and testifiers.
Please proceed.
Okay. Thank you. And so members, this House File 2927 contains the continuation of 2 waivers that were in place during the peacetime emergency relating to childcare. They are contained, I should note, in a bill that is moving through several other committees with some other waivers that are not in this committee's jurisdiction. And there's two sections, one relating to payments under CCAP, one relating to some staffing issues. And so what I'd like to do, I guess, I'm not sure if Inspector General Moti is going to be describing section 2 first, or kind of how we want to do this. But maybe Inspector General, maybe it makes sense to have you up with the chair's permission, and then we'll move on from there.
Inspector Moti, is that you are the next presenter? Please identify yourself for the record again and proceed.
Okay, thank you. My name, again, for the record, my name is Kulani Moti, and I serve as the Inspector General here at DHS. And so the waiver proposals for us make changes to staff distributions, and I know Ms. Unfeld is sharing her screen here. Here we go. On this is to help with staffing shortages that childcare centers are facing. And this would be that staff distribution requirements are temporarily suspended until June 30, 2022. Under the waiver, a childcare center would at minimum be required to have a teacher qualified person on site at all times, rather than being required to have a teacher in each group of children, and one person of at least 18 years of age with each group of children, rather than needing to have a teacher, assistant teacher, and or aide, depending on the size, with each group of children. And then a designated person to be on site who is responsible for overseeing the operations of the daily activities of the program, ensuring the health and safety of the children, and supervising the staff. The minimum staff to child ratios would still need to be maintained. And so this is what the licensing waiver would propose to make changes. With that, I believe I will be passing it off to Ms. Poseen to talk about the temporary changes to the child care assistance program.
Excuse me. Good morning. Good morning.
morning.
Members of the committee, I'm Lori Poseen. I'm the manager of the Child Care Assistance Program at DHS. And I am here to talk about this temporary policy change. What this does is it reinstates part of something we did during the pandemic peacetime emergency, which will allow for payments to providers who temporarily close. We chose November 1st because that's when the data ramped up, tied to the need for providers to sometimes temporarily close when they had illness, exposures, and positive tests. So we chose 8 weeks as the maximum that could be used based on some data we had from the time frame in the pandemic that this was allowed. And then the other provision in this bill does allow, as we did during the emergency, was to allow these payments to be made regardless of the provider's policy to charge private pay families, because it's another way to support providers and not kind of put them in a position to feel compelled to charge private pay families during these unusual circumstances. And we have a process to approve and track these billing requests. So we clarified that that would be, again, our process. And just to clear up a little bit of, there's anytime a child's scheduled to be in care and they're not there as an absent day. But CCAP has some specific kind of rules and language tied to absent days, which are when children are supposed to be there or, intended to be there and, might be absent for a number of reasons. And this policy about absent days is not changing, except for allowing the provider to bill if they don't charge private pay families. So in other words, we are maintaining our limits on absent days. That is not, there's no change to that as part of this bill. Because a closure is a closure. It's not an absent day because care is not available during that time. So I think that's my only slide. And yes, thank you. Sorry, if you want to go back, you could, in case there are questions, or are we moving through?
Well, Chair Pinto, why don't you direct us to where we are?
Madam Chair, thank you, and members. So two things I just want to clarify for folks that we've kind of done this in reverse order, and then this posting, the slide we're seeing right now is section 1 of the bill. The Inspector General spoke about section 2 of the bill. So we kind of did section 2 first, and section 1, as you can see, it's pretty simple, one slide apiece. And Madam Chair, there is one testifier. And so I guess I might ask that we go back to, we take down the screen, hear from that testifier, and I'd suggest do that, and then can have questions. And we may well need to put the slides back up, but probably should hear from the testifier as the next step, and then the questions I would suggest.
All right. Thank you, Chair Pinto. And our next testifier is Maria Snyder, Director of the Rainbow Childhood Development Center, St. Paul. Please identify yourself for the record and proceed.
Hello, good morning, Chair Pinto and Chair. I'm not sure of the titles. I'm a little new here. So thank you for having me today, members of the committee and Chair or Chairs. My name is Maria Snyder, and I'm the Director of Rainbow Child Development Center in St. Paul. Rainbow is a family business. My mom opened Rainbow in 1998. And as a special part of our vision, we've chosen to serve children that are typically underserved in a community in St. Paul. And to do that, we participate in Child Care Assistance Program, or CCAP. We're licensed for 63 children, and about 90% of our families utilize CCAP. For years, we've taken a financial hit by choosing to accept CCAP and get paid far below the market rate while still providing high quality care. We do this because we believe that all children, regardless of their family's income, deserve access to high quality early childhood experiences. Early on in the pandemic, Minnesota made the right decision to waive restrictions on absent day payments from CCAP. This crucial policy supported providers, families, and our community to help stop the spread of COVID-19. This policy also saved Rainbow from going out of business and allowed the families at our center, many of whom are essential workers, to continue to go to work and serve our community. When schools in St. Paul were unable to teach children in person, we opened up a school-age classroom with 15 children, all of whom participated in CCAP. At Rainbow, we've been very successful at combating the spread of COVID-19. We have not had a single instance of COVID spreading between children and in the classroom. This is in large part because we continue to encourage families to isolate themselves and their children when they're sick or considered close contacts. Families know that they can keep their children home when they're sick without fear of incurring a large tuition bill that they can't afford. By covering the cost of tuition, we're able to pay our teachers and keep our center open. We know that passing this temporary change to COVID-19 absent day policy will not cost the state any additional funding. According to DHS, the budget already established for CCAP will cover the cost of the proposal. If CCAP absent days were not paid, we would be forced to close. Failing to pass this temporary change to CCAP absent day payments would also promote the spread of COVID-19 and other illnesses, pass along unfair costs to families who are already facing poverty, force childcare programs like mine to close, a tremendous loss for children, their families, and a loss of employment for teachers. And it would further discourage childcare providers from accepting CCAP and ultimately decrease access to childcare for families who are already underserved. Rainbow joins with many other providers, teachers, and families across Minnesota to ask this committee and the legislator to please pass this common sense provision to pay for CCAP absent days. Thank you for this opportunity to testify this morning. Appreciate it.
Thank you, Ms. Snyder. We appreciate the testimony that you gave this morning. And more importantly, like that, we appreciate the work that you're doing and so glad the success that you've had in keeping your family safe and the children still receiving great care. I'm going to turn it back to Chair Pinto to continue the presentation of the bill.
Thank you, Madam Chair. Yeah, and no, I think we're, I want to make sure we have time for whatever questions there may be. These are, again, these were in place previously during the peacetime emergency and extending through the end of June, so a short amount of time. But in both cases can make a big difference, and certainly you just heard from Ms. Snyder. So, but nothing further, ready for any questions the members may have. Thank you.
All right. So at this point, members, questions to any of the presenters and to the chair author. And I see Representative Franson.
Thank you, Vice Chair Pryor. So my question is related to that slide that DHS had up on, I think it was at page 2. But it was about just up to 8 weeks for if they have to close down because of COVID. So is the department keeping track of maybe those frequent flyers of COVID just to make sure that that program integrity is there? Compared to maybe other programs in the area. Maybe there's one center or home that has more cases of COVID than in the area that might raise a red flag that they could be taking advantage and not really enrolling any kids or saying that they have sick kids.
It looks like Ms. Moti, will you be handling that question?
Thank you, Vice Chair Pryor, Representative Franson. I'm trying to wrapping my head around your question. Do you mind repeating it again? I just want to make sure that I understand it.
Representative Franson.
Thank you. My question is is there any frequent flyers that you've noticed? The frequent flyer of the center is shut down because everybody has COVID. And so then, their quarantine time comes up, they go back into business, and then they're all shut down again because of COVID. But down the block, there's another center that isn't as sick as often. So I'm just wondering what is in place, the criminals, if you will, the fraudsters can find loopholes and use it to their advantage, especially during times when everything has been used as an excuse for, well, we can't go in and check this place out because of COVID. You know, we've been very lax on our regulations for that part under the guise of public safety and COVID. So just kind of curious what place guards are there to prevent people from finding those loopholes and using it to their advantage when there's really no sick kids. And Chair Pinto and I kind of discussed this the other day when we chatted.
Yes, Ms. Moti.
Sorry about that. Madam Chair, Representative Franson. So it is something that we are mindful of, and we do are doing auditing and looking at it proactively, both from both tips and information data information that we're looking at. It isn't something that we particularly has been on our radar, that specific scenario, but it is always something that from a program integrity lens that we do look at. And I will say both our Financial Fraud and Investigations Division and CFS are working closely on this and looking at, with the mind of having program integrity at the forefront of it. So that's as much as I can speak to it as to today. And if you have further questions, we can follow up with you after the hearing, if that's okay with you, Representative Franson.
Sure, thank you.
And Representative Franson.
Nope, I'm good. Thank you.
Thank you, Representative. Other questions?
Madam Chair, I might just ask if Inspector General Moti could just talk at a little bit broader level to Representative Franson's question about the sort of pieces that are in place so that we can feel confident that these funds are, I mean, it's the particular, Representative Franson asked about one particular scenario, but I wonder if there's sort of some broader comments she can talk, the Inspector General can talk about the protections that are in place.
Ms. Moti, thank you.
Thank you, Madam Chair, Chair Pinto. I'm actually going to phone a friend here because I know Ms. Preston and her team have been working much more closely with this. And so Ms. Preston, are you still online for this?
Good morning. Thank you, committee, Mr. Chair and members of the committee. So I'm trying to think a specific response to your question, Representative Franson. I mean, we are not verifying, we can't verify whether a COVID case actually, or there actually is a COVID outbreak and demonstrate that, but we can look at patterns and behaviors among child care centers, who's open, who's reporting that they're open. And that also has a huge impact. Those closures have impact with regard to the grant funding as well. And so we're using our data to look at who's reporting that they're open, when are they open, is the information they're reporting to us consistent, and that crosses all of the grant applications as well as CCAP reporting that they're doing. So we're using the data to identify any outliers or red flags.
Thank you, Ms. Preston. And Representative Franson, any follow-up to, are we beginning to address?
It's Chair Pinto that has the.
Was that, there was a sweat.
I know we must look a lot alike today, but we both have glasses. But
Chair Pinto.
Thank you, Madam Chair. And I guess Ms. Preston was providing some good information. And I was looking back at the material we had from past hearings. And I guess what I was thinking about is especially the enhanced monitoring that we funded, to say, you know, there's particular oversight that when there are deviations, at least this is what I recall, and I'm looking at the material again that I said we asked staff to post, that, you know, in 2019, we funded enhanced monitoring of centers. And I recall this sort of data analysis looking to see, like, to Representative Francis' question, where is there a spike or a difference or a change? And that's something that, and I can see the Inspector General nodding. So that was what I guess I was trying to get at with my question, that Representative Franson had asked about one particular piece, but just sort of more broadly, as I recall, there's a lot in place now regarding, I remember the phrase data analytics being used a lot, and I can see Ms. Preston nodding. So I think I'll end the questioning there, but just to reassure members that there are these protections in place that we put in place and DHS is using. So, but I think that's all. And thank you, Madam Chair.
All right. So I'm pausing here to see if there's any other member questions at this point, because we're preparing to take a vote on this bill. All right, that was the pause. Thank you. Thank you, members. Chair Pinto renews his motion to refer House File 2927 to the General Register. The clerk will take the roll.
Representative Pinto, Chair. Representative Pryor, Vice Chair.
Aye.
Lead Franson.
Yes.
Representative Bennett.
Aye.
Representative Bolden. Representative Bolden. Representative Davney.
Daphne votes aye.
Representative Damath.
Aye.
Representative Jurgens.
Jurgens votes aye.
Bolden, aye.
Representative Cotiza Wattoon.
Aye.
Representative Morrison.
Morrison, aye.
Representative Wozlowick.
Aye.
Representative Vogelmont.
Aye.
Going back to Representative Daniels.
Daniels votes aye.
Thank you.
Bolden votes aye.
And I'm waiting to hear the,
And that is 13 ayes and 0 nays.
all right. With a vote of 13-0, the motion passes, and I will be turning the gavel back to Chair Pinto. Thank you.
Thank you, Madam Chair, and thank you, members, so much for the support of the bill. We actually have another motion that we need to address very briefly, which is from you, Madam Vice Chair, Representative Pryor, if you wouldn't mind moving approval of our minutes of the meeting of February 3rd.
So moved, Mr. Chair.
Thank you. And to confirm, members of the public, this is one of the items posted on our website. Members, any additions or corrections to those minutes? And not seeing any, this will just be a voice vote. All in favor of approval of our minutes from February 3rd, please say aye.
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 Any opposed? Not hearing any, so that motion passes. The minutes are approved. Members, just some notes for our next few hearings. A reminder that we have the hearing tomorrow at 10:30, the joint hearing with the Housing and Preventing Homelessness Committee. Just a heads up about that, there's a bill that's being introduced today that we will be hearing tomorrow, which I know is very tight, except that the language of the bill has been posted for a number of days now. Our committee will be voting on that tomorrow and referring it, the plan is to refer it to the Housing Committee. So just want to make sure folks are aware of that. It's a fairly simple bill. We'll be talking about the impact of housing instability on brain development tomorrow. On Tuesday, I'm expecting that we're going to be hearing from the administration on governor's budget proposals. And then the expectation is to not have a hearing next Thursday because we're having 3 hearings this week. So we should do 1 next week to balance things out. That's not definitive, but by Monday morning, you should get a note, but I would expect that that's very likely so that you'll have your Thursday morning at 8:30 free. Just seeing if there's any questions. I'm not seeing any hands seeing if staff has anything for me and not seeing anything there either. So thanks so much, members, and I look forward to seeing you tomorrow at 10:30 for our joint hearing. And with that, the meeting is adjourned. Thanks so much.